Well, joining us now, one of the most inspirational Indians, Amitabh Bachchan himself. Sir, you are an ambassador for this cause, for this mission. Everything you say has a profound impact on so many across this country. So what you say, it really does matter. So let me ask you, sir, my first question. Now more than ever, given the COVID pandemic, is it time for us to focus a lot more on hygiene, basic changes, hygiene habits? Because, in a sense, it's all linked. It's linked not just to sanitation, but basic hygiene is linked to COVID as well.
Well, somebody like NDTV that has always been doing a great amount of conscious work towards Swachh Bharat, Swasth Bharat. I think this routine has been on for several years. I think it's the 7th year when NDTV has involved itself in this campaign. And I think COVID just seemed to have happened. And because it has happened, a lot of changes in our behavior, in our habits have been seen and are taking place. And I think it's important that now you link the two things together, because there is a very impressive link as far as the pandemic is concerned, as far as the precautions that we need to take, all being linked to the campaign that has been run by NDTV for so many years. So yes, we need to be very conscious of both these campaigns, and more so now with the pandemic, as you rightly said.
So what are the biggest concerns when everybody talks about it, but it's perhaps the biggest danger? It's fatigue, COVID fatigue, lockdown fatigue, people not wanting to wear a mask. People are tired, whatever will happen, will happen. And there have been so many messages to tell people you need to be aware that the fight is hardly over. What can you do to reinforce that point?
Well, I think that we've already been speaking a lot about it. We've been doing campaigns on television. We've now got, what do you call them? The stuff that you hear on the phone when you get a call.
Yes.
That was done by the government, and I did that. A lot of people are getting fed up with my voice. A lot of people are saying, hey, I didn't know that, you were going to talk to me and stuff like that. But I think it's all in the interests of the campaign. So one idea is to, yes, keep doing the campaigns and keep pushing this thought that you need to do these very basic, simple precautions, because the pandemic is far from over, and anything can happen anytime. We still haven't found a cure for it, and that's terrible. And we haven't got a vaccine, but I really don't know how effective the vaccine is going to be. We haven't got a vaccine for HIV yet, and it's been years and years and years. So to hope that there will be a vaccine for COVID, needs to be looked at sort of distantly. But the precautions that need to be carried out are a must. We can only keep insisting on that. You rightly said that there's a lot of fatigue that is setting in. People are getting fed up of sitting at home. But, I think that this is some kind of a new order, which I believe nature is pushing us into. We've all been used to going out and doing things very freely. Suddenly somebody is saying, hey, you can't do that because, you can fall sick. And unfortunately, there are many cases where lives have been lost. So I think the fear of the lives being lost was initially very powerful. I've been through COVID, and I was in hospital for almost 24 days. I went through the treatment, which was all sort of, hitting in the dark. All the medical fraternity has been hitting in the dark as to what the cure can be. But the fact is, even after coming back out of it and being declared COVID negative and having developed certain antibodies, thanks to the medication that I was given, I was still quarantined in my home, in my own room for at least 14 days. I followed that. Even now, when I go out of my house, I wear a mask. I wash my hands as frequently as possible. Yes, I am working, but I lay down certain stipulations where I work. The studio needs to be sanitized through a particular chemical, which has now been approved in the ICUs, for example. There are separate corridors being built where you can't, get too close to me or the other people. Everyone that works close to me is wearing PPE units, wearing masks, wearing shields. These are some very basic precautions that all of us are taking. And I think that we can only become examples for the rest of the people by doing this ourselves and carrying on repeating that, you need to do this because it's still not over.
So do you see some hope at the end of the tunnel? We finally got the vaccines coming out. They'll be here in India very soon.
We will always have to depend on that because we always want to have some kind of a medical relief for this disease. And yes, we do hope that the vaccine does come out, does become effective, and brings a sort of strength of confidence in all of us. There have been cases where the vaccine has not worked. There have been cases where it has worked. And this will always happen. The medicines, some people, react to it positively, some do not. That's going to be a perennial kind of a thought. I do believe that we should be hopeful that the vaccine will come out and will be a kind of a savior for all of us. And I hope that is successful.
So we were speaking about COVID fatigue. What about the fact that doctors face a very real fatigue? They are physically and constantly working, paramedical staff, cleaners, cooks, all of these people in hospitals. How important is it for us to constantly be thinking about them?
Well, I have the greatest admiration for this fraternity. I've always had a lot of admiration for the medical fraternity because I myself have been through so many medical incidents. But during this pandemic, the kind of work, the kind of concentration, selflessly working towards people, saving their lives has been so admirable. There was a wonderful banner that was put up in Gujarat, I think, which said, if you find that the temples are empty these days, you know why it is, because the gods have shifted to hospitals in white attires. Yes. That's the kind of sentiment that the medical fraternity has been able to gather as far as this pandemic is concerned. Yeah. It's an incredible job that they're doing. Yeah. I've been in the hospital and I've seen how they work. The doctors, the nurses, they don't go home. They've been at it for 24 hours, day and night. They live on the premise. They don't care about their families. They care about the patients. They move from room to room, from ICU to ICU. The attendants, the staff that come and clean your bed and you clean your room and clean your washrooms, just endless amount of hours that they put in without ever being conscious of the fact that, they could be victims. And that is so admirable. We have the greatest respect and regard for them. Yeah. Not just them. A lot of the people that are like frontline warriors, the police forces, the other people that are working to bring essential foods and services to homes, they are equally at risk, but they are continuing to do their work.
Now, when we speak about Swachh Bharat and Swasth Bharat, it's also important to ensure that there is basic sanitation by way of soap, by water being available in every village as we speak about COVID. So how important is it perhaps to reassert the importance of last mile availability of basic water, clean water, so that people can be sanitized, that helps people protect their lives?
This is a huge question and this is a huge issue. Some of us that are fortunate enough to live in metro cities and have the facility of clean water, hopefully, and have the facility of having soaps and washing material, that kind of luxury is not available in the villages. And we can keep talking about it, keep washing your hands, but what does that villager do when he doesn't have soap, he doesn't have water? We've been pushing, sanitation and how to keep building toilets in the Swachh Bharat campaigns. And to a large extent, it has been quite successful. So we hope that through this campaign of NDTV, Swasth Bharat, we are able to push this with equal force and hope that people follow that. It's going to be very difficult for those centers that do not have this facility. I wouldn't like to put everything on the government. The government can do only so much and not more. But if a lot of private enterprises, private people, individuals can think of this thing, go out and, make charitable gestures to even their own house helps, it works very well. Yeah. That extra slab of soap that you may be using in your washroom, if you gave it away to your house help, he has that facility to be able to keep washing his hands. I guess that's the kind of sentiment that we need to project. Don't depend on everything on the services or the government services. Do something yourself as well and help out a fellow citizen.
How important is it for us to remember that beyond just COVID itself, there are patients being affected, the lives of families are affected, the lives of people working in industries, different parts of the economy. So when we speak about COVID, we need to go beyond just looking at GDP numbers. They're very real lives of people and their families which are affected.
A lot of lives have been affected. A lot of people have lost jobs. A lot of people's business has gone down. But what can we do? I guess you start pulling up your socks and starting all over again. Face the problem and just, try and overcome it by starting all over again, starting from scratch. Many people, many businesses that are now functioning from homes find it a lot more convenient. I mean, that's a very elitist look at it, but they function from their homes. Everybody's been given a laptop. I know a lot of the big the corporations overseas in America and in Europe, they've stopped calling their people into offices. They've supplied them with laptops and they conduct their business through that. It's working very efficiently. But we're talking about, the corporate world, and what about the common man, and how has he suffered this? And I don't know whether you are aware of that poor old man in Delhi who used to make food for people that he cooked, and he was in tears because nobody was buying his food anymore.
Yeah.
And that went on to the net, and it was so admirable to find hundreds and thousands of people coming forward and, helping him.
Yeah.
A lot more of that is happening, in the country. And that just speaks about the character of our nation.
Yeah.
So a lot more has to be done. And yes, we will have to bear this for a while. It's been a universal change. It's not just us, it's the entire universe. And everyone is finding ways and means of how to cope with it. And somewhere or the other, someone is coming across with some novel ideas and they're working. And I feel that some good will come out of this. Yes, I know it's terrible to talk like this, but I do feel that there's a lot of good that is also coming up. We never used to be paying so much attention to washing our hands, but look how many times we're doing that today, just to keep clean. Our parents always told us, go and wash your hands before sitting down on the dining table. Or have you come back from playing your games, go and have a shower, go and bathe, wash your hands. Now it's almost happening automatically. That's a learning. So I just believe that, there's a lot of learning that has happened in this country.
So just linking to the point you mentioned, it's so important. Now, it comes and as opportunities, a new way of business, a new way of transactions, the way we are communicating. Now through the internet, perhaps we would have had a satellite van outside your home, but we want to minimize that physical activity, hence we aren't there. But for many in our country, as we talk about technology which helps us, for example, in education, there is a huge digital divide. There are people, young kids, who can't even be educated because they don't have access to an instrument, a laptop, a computer, a smartphone. So is that something we need to focus on as well, the digital divide that exists in India?
When these corporations and when these businessmen decided to, digitize the entire country, they weren't expecting the COVID. They just wanted their mobile carriers to reach as many people as possible. The people that manufacture computers and stuff wanted their computers to go to as many people as possible. And it was a process. It was work in process. Suddenly now, with the COVID coming on, we've had to deal with it, as you rightly said, by functioning from homes, from computers. And the digital divide is there because there hasn't been enough time to reach these people, to give them their mobiles, to give them the internet connect. It is going to take time. And a lot of kids that have the means are studying from home, and they're quite happy with it. The only thing is, yes, they're unable to physically see their friends, their classroom teachers. And that's the same with people who are suffering from COVID and are in hospital. One of the effects of COVID in hospitals has not really been talked of much, and that is depression.
Yes.
The human being survives because he's able to see another human being. It's very important for him to keep seeing another human being. But in hospital, you don't see human beings. You just see somebody dressed in white. You don't see their faces. You barely see their eyes. You can't make out their expression. Your doctor that used to visit you in hospital, hold your hand, put his hand on your forehead and say everything will be all right, is not there. He's on a Zoom conversation with you, and he directs the doctors and the medical fraternity on how to treat you. These are some of the elements that cause depression. So yes, this is one of the areas that need to be looked into, that this can lead to depression, and we need to come out of it. We need to keep occupied, connect as often as possible, keep talking to each other. If you have an issue, just spread your mind out. Talk to somebody, just make a FaceTime call. Now, all this is happening because we have the facility of digital. But what about those people in the villages that do not have that connect? The only thing we can do is to ask these businessmen and these organizations to as rapidly make this connect, because we don't know how long this pandemic is going to last.
Yeah.
And who knows, once the connect is available, there may be a lot of other facilities that may come along with it. We may get better information. We may get better data. But yes, I do agree that there is this digital divide, and work needs to be done to, as soon as possible, connect the entire country so that the facilities that you and me are availing right now is available to them as well.
COVID-19 is a problem. It affects people around the world. What are some of the lessons that we can learn from outside?
You know, Vishnu, I'm going to be hated for saying this, but the Western world is learning from India because we've done rather well. And I'm very proud of the fact that a lot of the, the corporations within the cities, the municipal corporations, they've actually been rewarded by write-ups in the Western media as to how efficiently India has been able to manage the COVID-19. You have to understand a few things. Our population is the second largest in the world. And for a population this large, the kind of numbers that we have is nowhere near in comparison to something like, say, United States of America, that is hardly a third of our population.
Yes.
And therefore, I would put this thing the other way around. The Western world, you need to learn something from India because we've been able to do rather well. A lot of people were fed up with the fact that, why have you locked down? Why did you do this lockdown? And so on and so forth. But I think that when you don't know what's hitting you, the best thing is to just be quiet, shut everything down, and wait and see what's going to happen.
Right.
It also gave very important time, and this is sometimes not spoken on, very important time to the agencies to be able to get prepared. The medical fraternity and the agencies needed that time to be able to prepare themselves.
Yeah.
And they've done so well. I mean, here in Mumbai, we've got an entire arena that has been cleaned up with almost 1,000 beds.
Yes.
And the other day somebody came and said, I'm not getting admission. I said, why don't you go here? They say, yeah, thank you so much. I went there and half of it was empty. Just shows that, we are curing people faster than we are getting the diseased people.
Yeah.
And there are empty beds now. So the facilities they needed time to get organized. And I think that lockdown went a long way in doing that.
So just a couple of final questions. Firstly, your own Swasth Mantra. What is your mantra for good health?
We've been talking about it, and we've done several campaigns. Keep washing your hands, maintain social distancing. I think it's all right when you're inside a home and you're safe. Your family has been tested and they're all okay. But the moment you go out, there are some basic things that you have to observe. You have to wear this mask. You have to keep social distancing. Your sanitation has to be very clean. The streets need to be clean. And there are so many elements that go into the creation of objects and stuff that is lying around and that could be inviting this virus and infecting a lot of people. So yes, the Swachh Bharat campaign, the Swasth Bharat campaign are very valid, very important campaigns to be going out to the people as rapidly and as effectively as you have been doing in NDTV. But individually also, we need to keep talking about it. Every time any individual meets another individual, I think it's important to tell them. I sometimes drive to work and I find that the car that has stopped next to me or the bike that has stopped next to me is not wearing his mask. And I just put my window down and say, hey, can you put on your mask? That's it. I may get shouted at, I might get abused at, but at least I've done my job. And I think this is the way we need to just keep passing on information. Every time you see something which is not correct, to just say a word, just put in a word. How does it matter? It's not a waste of time. It doesn't take too much effort. There are young kids going around on motorbikes without the mask on. They stop at the red signal. My car comes and stops there as well. I just tell them, hey, put your mask on, you know. And I think the more of us that can be able to do that, the better it will be for everyone.
And so the people you're talking about, how do they react to Amitabh Bachchan telling them to put on their masks?
I never pay attention to that. It's just that I've been able to convey something. That's it. And a lot of times they have it slung on their neck and they never put it up.
Oh, right.
When they put it on. And some of them just give you a dirty look. But that's fine. I've conveyed what I had to convey.
Thank you so much, Mr. Bachchan, for being with us. We really appreciate it. It's wonderful speaking to you. Thank you very much indeed.
स्वच्छता, स्वास्थ्य और पर्यावरण का ध्यान जीवन का आज यही मंत्र है महान।
सच ये है बहुत बड़ा, ना भूलेंगे कभी, कह रही है ये ज़मीं और सारा आसमान।